I'm Camron Farjami. I'm from Palos Verdes Peninsula High School, and I'm presenting for Loma Linda University. Our project is basically a case report about a 55-year-old patient with a sacral alar mass. She came into the clinic at ISS stage 2 with an ECOG status of 4. Our case report is essentially arguing that when most oncologists see an ECOG status of 4, they would immediately assume that the patient is unable to take a more intensive regimen and therefore go for something less, something that the patient could tolerate a little bit more. Our argument is that ECOG is purely a physical indicator. It is not reflective of the patient's ability to tolerate more intensive regimens. So within this case, we started her on Dara-VRD and were able to achieve a partial complete response after only a couple weeks. After that, we decided to escalate to Dara-KRD, which then allowed us to receive a stringent complete response after only 8 weeks. Her ECOG status moved from 4 to 1, allowing her to move with cane-assisted movement. And then we decided to afterwards put her on ASCT and then maintained lumatamid, which allowed for her to achieve complete remission even after follow-ups. She was diagnosed with standard risk kappa light multiple myeloma. She had the standard symptoms, lower back pain. Specifically, she had a sacral alar mass, meaning that it was pushing on her spine and causing her to have that ECOG status level 4. So within this case, the most prevalent part is that it was a sacral alar mass, meaning that because of its location, that's the only reason that she was having an ECOG status of 4, because it was pressing on her nerves and causing her to be bedbound. But it wasn't reflective of her actual ability to receive treatment. So again, we went from Dara-VRD, started her on that, and achieved ECOG status move from 4 to 3. We then that allowed for her pain to be reduced. She started off with a hemoglobin level of 8, which was reflective of anemia. We then escalated to Dara-KRD, which moved her from ECOG status of 2 to 3 and allowed her within 8 weeks to have a move of a cane, which improved it heavily. And then we also afterwards maintained her on ASCT and maintain lapatinib, which allowed her to achieve complete remission after only a couple weeks. We have a couple more studies showing that quadruplet regimens are especially prevalent within patients like these. Specifically, Perseus, Griffin, and Master all show patients with ECOG status 4 to 3 being treated with quadruplet regimens, which have allowed them to achieve complete remission only after a couple weeks, showing its efficacy.